Welcome. It's a beautiful day, isn't it? It's a Thursday, the 24th. It's on April, the fourth month in the year 2025. And if you are accounting, you will be counting maybe the second year anniversary of the current administration, whether you are in Enugu or maybe you are in Ebonyi. Most of the people who took over office 2 years ago, just 2 years ago in 2023, May 29, in 1 month's time, there will be 2 years, in the saddle. But if you were to, judge by your standard, which of the governors do you think is doing practically very well? Who would you score a higher mark? I'm talking for those who maintained that May 29th handover. I know that some across the southeast, the governor of Imo State is not in that scorecard. We know the governor of Anambra State is not in that scorecard. I mean, the elections are due in November. So we have a whole lot of more people. But again, I just want to ask you, for you to engage with us, to tell us which of the governors you think are doing pretty well. So we have with us this morning Dr. Victor Ughaerumba. He's chairman, Nigerian Veterinary Medical Association, Anambra State. He's on the Zoom this morning. We're going to be speaking about veterinary medical practice in Nigeria. Good to have you. Thank you so much for joining us this lovely morning.
Good morning, Signature TV family.
Hello, Victor. Can you hear me?
Yeah, I can hear you loud and clear. Can you hear me?
Okay, I can hear you now. Thank you so much for joining us this morning. Can you give us an overview of the current state of veterinary medical practice in Nigeria?
Yeah, the veterinary medical practice in Nigeria is actually evolving, and it's not doing badly, relatively, if we might say. As I speak with you, we have over 6,000 veterinarians registered all over the country. We in Anambra State here, we have under the employment of the state government over 20-something veterinarians scattered all over the state. In fact, the state government has a veterinary doctor in each of the local governments, manning the affairs of the veterinary services in this local government. Veterinary medicine, like I told you, still has a lot of a lot to do, a lot of areas to improve on. I believe the present leadership of Nigeria Veterinary Medical Association at the national level is doing a lot to see that things come in shape. And like we always say, we say it's vet o'clock because it is within this period that we now have a separate ministry for livestock. The Federal Ministry of Livestock Development. It came on board just recently. Kudos to the present administration, our president, Tinubu, and the new minister of livestock. We've been able, and also through the effort of the Nigeria Veterinary Medical Association, we've been able to at least have a specific ministry that is dedicated to issues of livestock and animals. So I believe that's a step in the right direction. And we are all building on that recent development. So it's vet o'clock, like I told you. And I believe veterinary medicine in Nigeria is gradually growing. And the speed at which it's going, I believe things will come in shape soon.
Right. Well, what are the most common diseases that the Nigerian vet face today? And for you, are Nigerian vets prepared to deal with diseases like anthrax, avian flu?
In terms of training, we are ably trained and ably equipped to handle such diseases. Every single veterinarian that has been that has graduated and has been fully registered with the council is fully trained and ready to handle such challenges. The problem faced at times is probably a little bit of enlightenment and public knowledge about the profession and what it entails. And even like we are actually marking World Veterinary Day on come Saturday. And the theme of this year's celebration is Animal Health Takes a Team. So we are looking at animal health, not just from the veterinarians, but from the perspective of the animal owners. These are the little challenges we face in terms of taking care of these animals. But in terms of we as veterinarians being equipped to handle such diseases, we are very, very much equipped. The training system in the veterinary schools is rigid, and everybody that graduates as a veterinary doctor is actually sound to handle any kind of infection or any kind of animal health challenges anywhere he finds himself in the world. And coming to anthrax, like you just mentioned, I'm aware that there's been a nationwide vaccination exercise on anthrax. You know, here in Anambra State, we had a statewide vaccination exercise on anthrax, which ended some few days ago. I think last week, Wednesday last week precisely. That was on the 13th of April. And during that exercise, most grades were veterinarians in the state, both those in the public and the private sector, making sure that sheep, goats, and cattle are vaccinated against anthrax. So we are having that under our purview, and I think we're having that under control, knowing fully well that anthrax has not been recorded in this part of the country. And coming to avian influenza, there's been a lot of enlightenment, there's been a lot of training done by neighboring, non-governmental organizations, WHO, international health organizations, training veterinarians, engaging them on the recent methods, how to collect samples, how to do surveillance, how to control the infections. So I believe with the cooperation of these international bodies and the government, both federal and state level, we are actually quite equipped and ready to for the challenges that comes with such zoonotic diseases, like you mentioned.
So, but what are the most common diseases faced by vets today that affects animals? What are the most common amongst these diseases?
There's quite a number of them. You know, veterinary practices have to do with quite a range of animals. When you come to poultry, we have challenges of Newcastle is endemic. It's there. There's hardly a farm you go to and they won't tell you they've had issues of Newcastle. That's in poultry. And you have your Gumboro, that's the infectious postal disease virus. And you have your cholera, you have your E. coli, you know. And funny enough, good enough, these diseases in poultry are actually having vaccines. So when you are working with, if a farm is working with the right veterinary doctor, with a veterinarian, such vaccinations are instituted in the farm to take care of it. Then when you come to things like companion animals, like your dogs and cats, you begin to talk about parvoviral enteritis. You know, you talk about parasite infestations, worms and ticks, and then of course rabies. Rabies is also a challenge. It's not completely bundled out. There are times we have issues in certain cases in scattered numbers all over the country. But the thing about rabies is that everybody is really getting aware, and everybody is taking caution against it by properly vaccinating the animals. I hardly think there's any responsible animal owner in Nigeria that does not know he needs to vaccinate his dogs against rabies annually. You know. Then when you come to the ruminants, sheep, goats, you talk about PPR. PPR is actually a challenge in Nigeria, especially in this part of the country, southeast here. You know, and we as veterinarians are trying our best to contain it. You know, and you talk about contagious bovine pleural pneumonia in cattle, you know, and then of course your trypanosomiasis. You know, trips is a challenge because of the kind of environment we have here. You cannot completely rule away fly, which is actually a vector for trypanosomiasis infection. So in a nutshell, these are actually the challenges we as veterinarians face in these animal species as we go about our daily activities as veterinarians and animal health providers.
Many health epidemics or health challenges are mostly associated with, animals. Some of the health challenges that humans face are somewhat associated with animals. They mostly come from animals.
Yeah, there are quite a lot of them. You're talking about the zoonotic diseases. We call them zoonotic diseases, which are diseases
Yes,
that
but
actually
I wanted to
come
ask
from animals.
that this transfer of these diseases, do you think that is the failure of the veterinary profession? That's what is causing these diseases to spread from animals to humans?
Sorry, come again.
Like I mentioned, that some of health epidemics or health challenges that humans face apparently are linked to animals. Do you think it's the failure of the profession, that's the veterinary profession, that is making these things happen?
I wouldn't really say that. I wouldn't really say it's a failure on the part of the veterinary professions. But like I told you earlier on, veterinarians are actually ready and aware equipped to tackle any animal health challenge. Every single veterinarian out there, I can beat my chest and say that. But the point we have is a little bit of ignorance on the part of the general public on issues concerning animal health. Nigeria, the way Nigeria is, things are pretty tough, even for we humans. So it's when you finish taking care of yourself as a human being that you begin to think of how to take care of animals. So I think that is more or less the issue, the economic situation, which we believe things are actually being done about it by the government. But then people are actually going through a lot taking care of themselves. So they find it very difficult to do the necessary preventive measures as regards their animals. And so that is why you also have a little bit of snippet of such infections occurring. But by and large, it's not been so bad. It's not been so bad. There are quite a number of such diseases, like we just mentioned, rabies. We've talked about tracks, which we know it's actually presently under control, because the last we heard of it was in Niger State. I think that should be about 2023. And ever since that, we've had reported cases. Avian influenza will be having one or two issues on that, but certain measures are already put in place to see that it's properly in control. Then when you talk about maybe things like tuberculosis, which is actually a problem, the various slaughter slabs and abattoirs we have scattered over the country, the veterinarians, which is actually their jurisdiction to do meat inspection on a daily basis, are trying their best in that area, but there still needs a lot to be done as regards improving the state of our slaughterhouses, because this is one gateway which, if properly controlled, will reduce the transfer of these zoonotic diseases from animals to man, And then our control posts, which are, like I told you, we also have veterinarians working there, who might need to probably do a little bit of put in more serious work on the various control posts, both those entering the states and even the quarantine, our quarantine services, which are also doing a yeoman job and trying on their own. So I believe institutionally, things are actually put on check. What we need to do more this time around is to have a proper enlightenment, just like we're doing on air right now, and then telling people more about the dangers and what they need to do to prevent them having such infections. Surveillances are ongoing. We have surveillance officers scattered over the country that are doing their bits, And then again, like this year's World Veterinary Day is talking about animal health as a theme. We also need the One Health thing to work here. Let's have a collaborative effort between all the health sectors, both those in the animal and in the human health sector, so that we can do what we call tracing and a little bit of follow-up, knowing where each and infection of this infection. Are you coming to the hospital and probably you've been diagnosed of tuberculosis? We have a little bit of trace back to see if it is from an animal source, if it is from probably buying a product in a meat product in the abattoir, or something related to that. It's a coordinated effort between all the health workers, both animal and the human health workers, will help in controlling most of these zoonotic diseases, apart from the things I've mentioned. Thank you.
What for you are the challenges faced by young graduates who are veterinary doctors?
There's quite a number of them. There's quite a lot, you know. It's and that's why I told you any vet graduate is actually well equipped to fit in, no matter how difficult the situation is. But to be very frank with you, a lot of those young graduates face a lot of challenges because starting up is an issue, and there is very little placement positions both in government and even in the private sector for them, because it is veterinary medicine is an area where you as a veterinarian, you come out and you look at it as if it's a yeoman job. You have to just do everything yourself. You have to start up yourself, and basically, like some other professions like that are related to ours, you have this opportunity of having a 1 year house job where the government takes care of most virtually everything about you, and within those periods you develop yourself, and after the 1 year you literally have to stand on your own. But in the veterinary medicine, once you're done with that 6 years, you're out there, and after your youth service you're on your own. If you're lucky to have a government job or to get employed in a private sector, you start up there and begin to gather your tools and gather your experience to be on your own. But it's not been easy. I know it's a work in progress. Now that we have our own separate, now that we have a ministry of livestock, I believe these are one of the they are going to look into. And then we'll have the council. You know, the funny thing is that at the time, stories were being told about the funding for the council, Veterinary Council of Nigeria, the government withdrawing their funding. And we were like, why would the government withdraw their funding for the Veterinary Council of Nigeria, which is very, very important, and sees to the activities of veterinarians all over the country, and regulate what they do. And so, but I believe I think that idea didn't sell again. I am not actually in a good knowledge of that, but I believe somehow along the line the idea didn't sell through. You know, so these are part of the challenges. These are part of the challenges as young veterinarians coming out and having to face a public that has little knowledge of what your profession is and how important you are in the society. You know, but like I said, we are actually trained and properly trained to face such challenges because of the rigorous training we go through in school. And I believe over time these challenges will be surmounted. We have great veterinarians that have surmounted these challenges, scattered all over the country, and they are doing pretty well both in private and the public sector, and contributing their quota to ensuring animal health and public health. Thank you.
How is technology assisting with veterinary practice in Nigeria?
We still have a long way to go in that respect. You know, we still have a long way to go in that respect. Down here in the southeast, you won't believe that we have very little veterinary laboratory presence. You know, and so at times, most of the time, you rely on what you call tentative diagnosis to do your diagnosis and make your treatment. You know, because of the absence of laboratories. You know, and then in terms of instrument and facilities, we really still have a long way to go in that respect. You know, in the north, there's a lot that is being done. You know, like in the north, back then in the days, you could hardly talk about issues like artificial insemination, but in the north, it's a common thing right now, and that's a technology that has come to stay, and is gradually spreading to other parts of the country. You know, and then surgical procedures. You know, before you to perform certain surgical procedures in your little clinic around here, a lot of technology and a lot of facilities will be needed. But those things are not really available. So some people try to do a makeshift and perform the operation because of the proper training and you understanding the idea behind whatever surgical operation you want to perform. So there's a lot to be done in that aspect. The clinics like in Anambra State here, like I told you, we have veterinary clinics scattered all over the state. In each local government, there's a government veterinary center. But the facilities in those centers are not near what it should be. the government have done well employing veterinarians and providing them that center. But we believe there's still more to be done. And I know the good governor we have, the hardworking governor we have, who is a technocrat. It's along with the commissioner and the PAMSEC. I was with the commissioner of agriculture the other day, and we talked at length about these things. And I believe plans are already on ground to see that most of these things in our states are sorted out, facilities are provided, equipment are provided, and then technical know-how is also enhanced. So it's an upcoming thing. Like I said, veterinary medicine, it's a growing profession in Nigeria, give or take. A lot of people still really don't understand when you say you're a veterinary doctor, begin to explain what you do. And it is just because, like I said, they refer Nigeria as a developing economy. And these are the effects of being a developing economy. You know, the challenges are there. We're struggling to take care of ourselves as humans. And then you now begin to talk about bringing in facilities and sophisticated technologies to take care of animals. We've not done enough of that in humans, and it's also going to have a ripple effect with doing that much in animals. Thank you.
All right. For you, do you think that the government is, really putting an eye on that aspect of medicine more? Because again, we rarely hear anything that the government is doing in terms of launching anything or even improving that particular aspect of our medical lives. Do you think that more still needs to be done, more investment must be done, in that regard, compared to, the other aspect of medicine?
You're definitely correct in a way. There's still a lot to be done. There's still so much to be done. The government involving themselves, the private sector investing and playing a role. But by and large, at the pace we're moving now with the present MDMA chairman, Dr. Arokoyo, and the various state chairmen of NBMA, I think with the noise we're making, awareness is being created. And I believe that, like I said, it's 5 o'clock. We now have a new ministry, which is less than a year old. And plans are already on ground. And we're also having a lot of collaborators, a lot of non-governmental organizations, a lot of health organizations coming in to help. There's this Press, they are doing their bit too. So with the collaboration of private investors, governments, and health organizations, international health organizations, I believe these challenges will be taken care of. I don't want to spend time talking on the problems and the challenges we have. I rather talk on the way forward, because in terms of problems and challenges, there are many. They are actually what you call daunting challenges. But I believe with what and the mindset we have right now, we are moving in the right direction. And I know in no time, veterinary medicine in Nigeria will be seriously improved. All the sectors, all the governments will be seriously involved. Organizations, international health organizations will be doing a lot. There's already programs, quite a number of them on ground for that. And then for the media, we appreciate you people also help us to sing our song and do more public enlightenment, because the more you talk about these things like we're doing today, the more people get aware, and the more things are being done, solutions are provided.
What regulations are available right now that regulates the practice of veterinary doctors and its practice in Nigeria? And are those laws adequate? What would you suggest as more in terms of regulating that space?
Yeah, one thing in Nigeria is that Nigeria is not actually short of regulations and rules, but it's about implementation. There's quite a number of them. Let me move from the local government upwards. Are you aware that in every local government, that the local government has a jurisdiction to see that every dog on the street is licensed? Every dog on the street is licensed, and if you're not, you're taken to court and charged for that. So it is expected that, how far is this being implemented at our local government level becomes another thing. Now, when it comes to regulation, we also have the Veterinary Council have what you call the Veterinary Premises Regulation Committee, Registration Committee, Regulation and Registration Committee. And this committee, for the past couple of years, 2 years or more, has been working seriously. In Anambra State, here, we had a drive where we had to close down some veterinary premises that were not properly registered, that were not practicing the way they should practice, that does not even have a veterinary doctor overseeing the activities. We had to close them down. We had to make them follow the right path of registration. So there are regulations that are ongoing. You know, we still have people who have not, we've not actually implemented the regulations to the fullest. And I don't think we've done 50% of the implementation of this regulation. So there are regulations. We are not short of regulations, but it's all about implementation. But I believe someday we're going to get there. We're really going to get there. Yeah, there's the Meat Edict Act, there's the Veterinary Premises Registration Act, and then domicile both in the state and the federal government. And there's also the Dog License Act too, which is at the local government level. You know, so there is quite a number of regulations. We are not short of regulations. The problem is enforcement of these regulations. And that's why we're also appealing that the forces we have, the police and the civil defense, which are mostly the people who work with, should always be ready to open their doors to us. Because you know, in Nigeria, if you don't enforce certain regulations, nobody listens to you and nothing is done. I want to appreciate the police that are actually doing a yeoman job in working with the Premises Registration Committee at federal and state level, and that is because we have our own, who is an AIG, Aishatu Abubakar, as at the helm of affairs in the Nigerian police, which is actually pulling strings and helping us with that. So we appreciate our effort in that, and we are calling on the civil defense to also come up and be of help, and anytime we approach them to help us, because without enforcement, these regulations wouldn't come to limelight. Thank you.
All right. Dr. Victor, many thanks for your time. We truly appreciate. Dr. Victor is the chairman of Nigerian Veterinary Medical Association in Anambra State, and giving us an insight into veterinary medical practice in Nigeria. Many thanks for your time, sir. We appreciate.
Signature TV, news in your pocket.